Good morning. Okay, mic's on. Good morning, everybody. Welcome to our panel on day 2 of this fantastic gathering with people from around the world. My name is Stewart Ibarra. As I was introduced, I'm the Executive Director of the Inter-American Institute for Global Change Research. And we have a fantastic panel with us today online. We have colleagues here from around the world and Kevin. So we're going to get started. This panel really buttresses beautifully with the discussions we've had this morning, inspiring comments from the last panelists and speakers about the need for integration across the different Rio conventions and the need to think about monitoring and measuring what success looks like. If we don't have the right data, how do we know what's already happening in our communities? How can we know if a new intervention and a new investment is actually having the impact that we desire? And so this is really fundamental to measure and monitor the success that we hope to see in the future. So very briefly, introducing our panelists. You've already heard from Kevin. We have online with us here Dr. Diarmid Campbell-Lendrum, head of the Climate Change and Health Unit at the World Health Organization headquarters. Diarmid, just say hello. I'm just introducing, here, everyone wave, there you go. He's up there on the screen. Dr. Stella Hartinger, associate professor and researcher at the Universidad Peruana Cayetano Heredia, director of the Center for Latin American Research on Climate Change and Health, and she also directs the Lancet Countdown for Latin America on health and climate change. Welcome, Stella. Dr. Sheetal Lookhar is the global head of health and nutrition at Save the Children International, leading work on climate-resilient health systems, maternal and child health, nutrition, and humanitarian responses. Welcome, Sheetal. And last but not least, Dr. Andrêa Ferreira is senior researcher at CIDACS, the Center for Data and Knowledge Integration for Health, which we heard about this morning, a research unit of Fiocruz focusing on large-scale health and social data integration in Brazil. And so we're going to get started. I'm going to pass the floor first, actually, to Dr. Stella Hartinger, because she may have to jump off the panel a bit early. So we're changing the order. Please bear with me. Stella. So I've had the opportunity and honor to be good friends and colleagues with Stella for many years and to partner on the Lancet Countdown. Stella has led the Lancet Countdown for Latin America over the last number of years. And we know at the global level, the Lancet Countdown has generated a large data set of global climate and health indicators. And Stella, as you've led the Lancet Countdown in Latin America, you've worked to test and improve these indicators to better reflect the realities of our region. Can you tell us about how you and your team have innovated to create more appropriate and useful metrics for decision makers at both national and subnational levels in the region? Please, Stella, go ahead.
Hi, Anna. Thank you very much for inviting me to this panel, and I apologize if I had to leave a little bit early. Your question is very difficult to answer, actually. As you're just saying, the Lancet Countdown has been working for many years, or for the last 10 years, on aiming to monitor the impacts on well-being and of the impacts of climate change and well-being and health at global and national levels. In the previous conversation or in the previous discussion, we were talking about, I was listening to say that there is not enough research or information available. And that's not necessarily true. Actually, in the previous panel, we were discussing that there's a lot of evidence already out there that links climate change to health. And I think it's important to say this because we don't need to produce excessive amount of research. We just need to fill the gaps in some of the regions. And of course, Latin America was one of those regions where we needed to fill some of these gaps because it was making it difficult to transform the information that was available into adaptation and mitigation strategies that are specific and that were important for the region. However, and of course, saying this, one of the biggest problems that we have is tracking the indicators that we are producing at the global, traducing them a little bit more into national levels that are relevant also for the countries and then going subnationally. And one of the biggest things that we're finding that complicates this is the lack of data that the countries have available to actually use. Another big of the challenges, Anna, that we're finding is this heterogeneity in geography, socioeconomics, culture, and infrastructure, so that we can actually have good metrics to measure indicators. Other components that we're finding that is happening and that are very challenging right now is that we're working in silos within our countries and even more into national sectors. What do I mean? We have, for example, in one of the studies that we did in the Lancet Countdown, Anna, we did an analysis of the NDCs and the national adaptation plans that we have up until 2023. And what we found is that despite having information about baseline data on the impact of agriculture and food security on health, or biodiversity and environment and ecosystems on health, there was really no leading institution within the Ministry of Health or any other sector that was leading this initiative, had a good financing structure within that adaptation plan, and had good measurements of indicators of success within this type of sectors. So really, despite of the work that we're doing that could be used to help policymakers, we're doing a very poor job, I must say, to translate this into subnational governmental policies that we have to implement this adaptation and mitigation strategy subnationally. I hope I've answered your question, Anna. I'm just having a little bit of noise around me.
It's okay. Thank you so much, Stella. Fantastic way to kick off the conversation. So I'm going to go next to Diarmid. Diarmid, take us out to the global level. And please share some comments from your perspective working with the WHO at the global level to support the development of these standardized climate and health indicators, but also now how we address the challenges that Stella just mentioned. How do we take these indicators to national and subnational levels to have the impact, the real world impact that we need?
Okay, thanks very much for the introduction and the invitation to speak here. Can I just check I'm coming through clearly enough in the room? You can hear me? Fantastic. Okay, so bom dia todo mundo. It's a real shame that I'm not with you in Rio. It would have been a real pleasure to be there, but I'm really pleased to be taking part in this discussion because it is now critically important for us at WHO to be able to measure success. And WHO has actually been banging on about climate change and health for, I count this now, 35 years. WHO published its first report in 1990 on climate change and health, and we published our first estimates of the burden of disease from climate change in 2002. And what we've been able to do is to gradually build up the interest on this issue, along with partners, we're good collaborators of the Lancet Climate Countdown and others, the growing ecosystem of researchers, activists, committed people from ministries of health, to the extent that climate change has now been elevated to be the first of only 6 strategic priorities for the global public health agenda for the next 5 years. So that's WHO's general program of work, our 14th one, but it's agreed by all of our member states. And when you do that, when you get people to convince them that this is arguably the greatest health threat that we face, the next question is, okay, what do you want us to do about it, and how do you know when we're succeeding, if we're succeeding? So from the WHO point of view, we need a couple of simple indicators for that. And we think it's critically important that we cover both the adaptation and resilience agenda, also the mitigation agenda, because we can't adapt our way out of this problem if we don't mitigate, and the health sector needs to do its bit in mitigation. So we've basically boiled this down to one single indicator on adaptation and resilience, basically a composite indicator of the different domains in which health systems need to improve to make themselves resilient. And we've picked the indicator of carbon emissions from the health sector globally, because it's about 5% of global carbon emissions. And when I say that, you'll appreciate that only tells a very small part of the story about the multitude of connections between climate change and health. So we're also very clear that those can be headline indicators, but a wealth of other information needs to be collected, and in fact is being collected at the global level and so on. And I'll just mention one other piece of work which makes this connection between the global and the local. So my colleagues Andrêa and Carlos Corbalan, who work with our team, recently did a piece of work where they looked at all of the things that countries had put into their vulnerability and adaptation assessments or their health national adaptation plans. They divided that up into a framework of looking at what they said about hazards, what they said about enabling environment, actions, future projections, and so on. And they looked at how many things countries were claiming should be done and therefore should be measured. Now, I'll let you think for a second about how many indicators they came up with out of this. The answer is over 3,800. And when they took out repetitions and so on, they ended up with about 1,700. Now, that's too many for us to standardize. And I think the final thing I wanted to say on this point is that we need to understand that's not necessarily a bad thing, because maybe you need that wealth of indicators adapted for different places to be able to tell the full story of what needs to be done. So diversity and equity and inclusion are really good for indicators, as well as you recognize that you need different jobs for different purposes. You need simple things at the global level to say, are we getting on top of this issue or not globally? You need a diversity of measures at the national and local level. Thank you.
Great, Diarmid. So I think that's a fantastic point. So having these simple, sort of standardized, headline indicators at the global level, which is useful in certain decision-making spaces, but then needing the nuance and the context and perhaps a diversity of different kinds of indicators that really reflect the realities of the current surveillance systems, the realities of the governance structures and the needs of the countries, or even at the subnational, municipal levels. Thanks, Diarmid. So over to Sheetal. Sheetal, from your perspective at Save the Children, I know you're very passionate about the importance of maternal, fetal, and child health indicators. Can you talk to us about why that is so important and what's happening in this area, and maybe if there's nothing happening, what needs to be happening in this area?
I think, thank you so much. And I think one of the critical things that we need to take a step back, right? I know there's a lot of work that has happened in defining or identifying these indicators, but I really want to bring this panel back to one of the central components of any climate health indicator framework, which is vulnerabilities, right? I think there's a strong need to unpack this concept. The risk groups, the high-risk groups, such as children and pregnant women, are not homogeneous. They have different overlapping multitude of risk factors, which increases their vulnerability to climate change. For example, we know that a staggering 88% of the global disease burden due to climate change is being borne by under 5 children. And I want to emphasize under 5 children and not just infants, because most of the data that is available globally is again focused on infants. Secondly, the second most important group, which is highly vulnerable to the impact of climate change, is completely missing from climate health discussion, which is pregnant women. We know exposure to heat wave increases their risk to preeclampsia, eclampsia, gestational diabetes, as well as cardiovascular event during labor, but also they lead to adverse fetal and neonatal outcomes, increases risk of stillbirth. We still have over 2 million stillbirths every year, and 89% are in low resource setting. Heat exposure also leads to increase in prematurity, low birth weight babies, and congenital anomalies. All these 3 are major causes of newborn deaths in first 28 days. And I just want to say that these are vulnerable groups, and I agree with Stella. We have research that shows that these are vulnerable groups. We don't need more research. But what I want to argue is we need to understand when children, pregnant women are in fragile and conflict-affected settings, when these groups are in migrant communities, when these groups have disability or belong to indigenous population, their risk increases a lot. We need to be able to have population-level data and matrix to help us identify and prioritize intervention that will reduce these risks and make sure that our adaptive responses are actually fit for purpose. Because lack of this data is creating kind of an equity blind spot. We are missing on prioritizing intervention. Secondly, also we don't have data to really understand individual level risk factors, right? Because of that, we are delayed in developing protocols, clinical guidelines, and management pathway, which can really support pregnant women and, in terms of mitigating those risk factors and making sure our response are really tailored to the risk profile of an individual. I also want to bring back this discussion about local level indicators and data. We just don't have climate exposure data from the local level, especially in the kind of communities that Save the Children works in. And that's such a missing critical data gap. Unless you have this data, you really can't tailor your actions and responses to really be kind of based on information. And also having local level climate exposure data is such a powerful tool to engage with communities, right? If you tell communities about these risks, they will get involved with you in climate health actions, as well as it will increase community engagement and ownership to really co-create solutions. I think it's so important to take a step back rather than jumping into defining indicators to first unpack vulnerability, context-specific vulnerability, as well as intersectionality of different risk factors, which goes beyond health. And I really want to urge us to not fall into the same trap of having very siloed, health-focused approach to these indicators, disease, prevalence, incidence, but really look at broader determinants of health, which are much more important in climate context to really address. Thank you so much, Anne.
Thank you, Sheetal. And that's actually a beautiful segue to what Andrêa will be talking about next. So just to highlight some of your main comments, the importance of this intersectional approach, looking at differences with different cultural groups, age, location, gender, risk is not the same everywhere, and we need the data to back that up and to understand what's happening in different local contexts. The fact that pregnant women and the impacts of climate and health on pregnant women are largely missing from the data and the monitoring, that's a huge gap that you've mentioned. And the importance of measuring and monitoring climate exposure at the local level in these high-risk groups. So I want to pass the floor to Andrêa. Again, fantastic transition, because Andrêa, a lot of your work really has focused on using big data to now look at these social vulnerabilities, to use a focus on health equity, to understand the impacts of climate on health across Brazil. Can you please tell us a bit about your work, Andrêa?
Yes, good morning all. Nice to be here with you all. So at CIDACS, there is a data lab at Fiocruz-Bahia. We have been working on the integrations of socioeconomic data, including demographic, living condition, and also social protection programs with health data. So our idea was to create two cohorts. So we have right now the 100 million cohort that have more than 140 million disadvantaged Brazilians, and also the CIDACS birth cohorts. And with the advance of the effect of extreme weather event due to climate change, we are now building a climate platform to integrate environmental, climate, and health data, because we understand the importance to study the effect and impact of climate change in different groups and communities. Therefore, with the climate data platform at CIDACS, we are right now trying to create studies to understand the difference and the diversity of the impacts of climate change on health outcomes, focusing particularly on maternal and child health outcomes, but also chronic and infectious disease. So right now we are using the cohort that we have to study the intersectional effects of inequalities, climate change on health outcomes, focusing particularly on racial, economic, and gender inequalities, because we want to understand how those effects are spread in the Brazilian territory, and how social protection programs like Bolsa Família, for example, or the adaptation program that we have here in Brazil called 1 Million Cistern, can help to reduce the burden of disease that climate change increase. So the idea is to understand those effects, and thinking about what we are talking right now here, I think the importance of integrations of data, and also how to harmonize those data so we can compare different regions, different realities is very important. So from our side, we are moving forward to think how we can also put all those data available, so civil society and also a policymaker can access those data and create new actions or even new public policy, so we can move on faster to climate adaptation. So right now we are focusing on extreme temperature and air pollution, particularly thinking about those groups that are more vulnerable to those effects. But we also want to move forward to fill those gaps when we talk about traditional communities, for example, quilombolas communities, and also other invisibilized groups that sometimes is very difficult to access data to study the effect of climate change. So with the 2 cohorts that we have right now, and the creations of the CIDACS climate platform, we think that this can help us to move forward, and considering the diversity of realities that Brazil have, we can also think about how to translate this experience to other realities across the global south. And this will help us to think about how to create indicator that can be from the local to the global level. That is one of the most important gaps that we have right now, to think about the aims for the climate agenda, particularly the adaptation agenda. So that's why we are open to share this experience and also share the data that we are creating right now to help policymakers to move on faster, considering the huge effect that we are seeing, thinking particularly on health outcomes for the Brazilian context, but for sure that can be expanded for other realities. So thank you so much.
Mm-hmm. Thank you so much, Andrêa. And certainly Brazil is a leader in the region and globally, and many people are looking to see what Brazil is doing so that we can learn and scale these approaches to other communities around the world that desperately need to monitor and evaluate what's happening with the impacts of climate on health. So Kevin, before I turn to you, I just wanted to remind everyone of some of the comments that came up in the last discussion, which I think are so relevant for this panel. And I made some notes here. You know, Daniel talked about how all sectors need to be thinking about the impacts of their actions on health, but they also need to be monitoring this. They need to be measuring this. Cecilia made a comment, something around the lines of, we need indicators, but they don't need to be perfect. So we need to advance where we are today. And Liz reminded us also that we need indicators that are integrative, that are looking across the different Rio conventions, also to ensure that progress in one area isn't making harm or you know, taking us backwards in other areas. And so one of my questions is about, are we gathering the right data? Do we have the right surveillance data? And by surveillance, I mean in the broadest sense across the environmental sectors, social data, health data, to be able to really measure and understand the impacts of climate on health, to measure the impacts of new interventions on health outcomes. Can we even say that with the data we have? How do we need to improve that? And this is really important from an equity perspective also, because we've heard today from our panelists and earlier that certainly the areas around the world that are most impacted and most vulnerable to the impacts of climate on health tend to have the greatest challenges with surveillance and with monitoring systems. And so how do we address this in the context of indicators? Kevin, over to you. And then we'll do a round of just comments and reflection from the panel. I want to give a chance for everyone to just react to what they've heard and to sort of deepen some of their comments. So first to Kevin, please.
Yeah, so I think in my experience when talking about indicators, often the conversation does veer towards, are these the right indicators? Are these the best indicators? What are the right indicators? What are the top ones? And I think that can be a good conversation, but also something that we need to be wary of, because I think it can also provide or, you know, give us tunnel vision. Essentially focusing on a just small component of a very complex problem. And indicators are by definition just a reflection of part of a problem. And so I think we need to really make sure that we embrace the complexity, recognize that an array of indicators are needed, but at the same time have the conversation of what are the right indicators or the top indicators that we want to prioritize. I think one thing that I've experienced is that a lot of the indicators are focused on process and less so on outcomes. For me, I think when I think of climate change and health, this is a conversation about health. And when I think of outcome indicators, I think of those being focused on health. How many diseases did we prevent or not prevent or deaths that we averted or not avert based on our actions or inactions.
Thanks, Kevin. And so the need to maybe make sure we're really looking at health outcomes, which is what we're most interested at the end of the day, right? But also maybe one of the most challenging things to measure. And now in the discussions around attribution, even more important, I hear this talking to some of our member states, that they're really shifting actually all of their climate change research programs to focus on attribution in the context of loss and damages, being able to have concrete evidence to tie, for example, an extreme climate event to certain health outcomes, to be able to measure and show the impacts on mortality, morbidity, economic losses is critically important if we want to be able to mobilize resources for the communities that are most affected. Thanks, Kevin. So back to our panelists online. Who would like to jump in first? Please go ahead, anyone. The floor is yours. And if not, I'll call on someone.
I think I can go from the last to the first. I think it's very important to discuss these issues, but also I would like to bring to the floor that we are not start from the zero. I think we have a great experience in create indicators from different and many agenda. So how we will move forward in the climate agenda, but learning from the past experience. I think this is important, particularly because we need to understand that health needs to be a cross-sectional issues in the global agenda and not just an accessory or a point of. So I think when we think that we need to think in a broad approach that considering health as a core pillar inside the climate agenda, we can think better in indicators. Also, I think it's very important to highlight that we need to take into account an intersectional approach to think about indicators, particularly when we think that health is a result of inequities, and those inequities are directly related to the carbonization process that bring us to this point. So I think that we need to bring all those past experience to think about new indicators, but also how we can use past indicators to move on the agenda, and also intersect different domains so we can have simple indicators, but indicators that reflect the local and the global scenarios, so we can literally follow the indicators and bring equity. Otherwise, we will just repeat the cycle of carbonization. So thank you so much.
Thank you so much, Andrea. A question for Stella from the audience. Stella, how are you measuring or monitoring the breakdown of silos across the sectors to improve integrated policy making?
I think that's a good question, and it was part of the things that I wanted to discuss now, because in the Lancet we actually are looking into 5 big topics, big domains that I think we should focus on. I agree that the health outcomes indicators, the impacts, the exposures, the vulnerability towards climate change, yes, we should definitely measure that to see where we're moving, where's the progress going. This is what Diarmid, I think you were discussing. WHO's actually also creating this set of indicators to track this. But we need to continue to look into the adaptation and resilient plans for health, on mitigation and health co-benefits. Are we doing what we're saying that we're doing in the NDCs, in the national adaptation plans? And I think that there is the huge, biggest gap that we're finding. Again, in a scoping review series that we did a couple years ago, we were looking into how many mitigation strategies were placed or what were the outcomes out of this. And we found so little research in the Latin American region of anything that has been implementing. Mm-hmm. So we have it very nicely written in our NDCs previously, but we're not tracking what's happening. So there's different types of indicators that we need to look at. We need to see the global indicators. How is the world moving, going towards the impact of climate change? But at country level and at subnational level, we need to see if the country is actually responding towards climate change by including adaptation strategies, by adding mitigation strategies inside the country. This is what we're lacking now. There is no progress towards that scenario. So how are we talking, or how do we crack these silos? This is very difficult to do within our government. And the reason that it's difficult, it's because, for example, the Ministry of Agriculture or the Ministry of Environment do not understand the pathways that I think they were describing in the beginning. How does climate change, so why does climate change affect health? Those pathways are not understood. And what it's also not understood is that the response of the Ministry of Health, something so simple that creates, I don't know, water or sanitation or hygiene. Yes, we do it at a household level, but we don't do it at an infrastructure level. And if the country does not respond, these are the inequalities that I think Andrêa and Sheetal were talking about. We don't respond to that, we won't see an improvement in health, and we will continue to be in this cycle of poverty that will continue to govern our countries, or the most vulnerable countries. I hope I answered at least part of the question. Maybe Diarmid, you can, you will have the rest of the answer.
Oh, fantastic. Thank you, Stella. How about Sheetal? Over to you. Any reflections from what you've heard?
I think yes, and maybe just let me add a nuance to this discussion. I think in terms of the data behind the indicator, one of the critical use of indicator is to help policy and decision-making process, right? So I just want to bring that back to the high-risk setting, right? Especially the humanitarian setting and the crisis, where we have exponential increase in exposure as well as reduced resilience at individual and community level. And I just want to, ask the panel that humanitarian crises right now are not short-term event, right? The kind of average length of a humanitarian crisis is 3 years, like 7 years, right? 90% of these crises are 3 years over, right? Can we use data and indicator to really help us guide integration of climate health adaptive measure as a part of humanitarian and development nexus approaches? Just bringing back to Stella's point, if you don't invest in building systems, you're not going to see any impact on climate change health outcomes, right? It has to be a coordinated effort, especially so in these high-risk settings where resources are so limited. I think it's very important to look at these indicators not just for monitoring health outcome, but also helping us guide those policy decisions, especially for crisis setting, where pregnant women and children are really the maximum brunt of the climate change. Thank you.
Mm-hmm. Thank you, Sheetal. So again, thinking about this from the perspective, the humanitarian response, but also going back to Daniel's comment that all sectors generally have an effect on health and climate and health. So how do we ensure that these sorts of indicators are really being taken in from a place of ownership, where the sector themselves sees the ownership, sees their impact on health, and brings us into their routine monitoring and evaluation and planning processes? Over to you, Diarmid.
Yeah, thanks very much. And first off, I won't repeat what others have said, but just to endorse it, all of these points about looking across sectors, to look at the determinants of health, to adapt it to different settings, and so on. I completely agree with all of that. But I'd just like to further develop a point which has been raised to some extent, which is the importance of not just measuring the damage or getting better information about how terrible climate change is. For the most part, people know that. Even the people who deny climate change actually, I think, know it. And there's clear, support across populations around the world that climate change is a problem, including for health. We need to act on it. The next question, which we have some information on, but not as much as we should have, is what specifically do we need to do about it? Mm-hmm. And here I'm going to be a little bit simplistic. I know that it varies from, there are different answers in different settings, but we need to be able to show that there are specific actions that we want governments to take that will work in order to address at least some part of the climate and health crisis. And we haven't, I think, as a community, spent as much time as we should on that. And we actually now have pretty good information, including good economic analysis, for a limited number of interventions. We're really quite robust systematically compiled data on heat health warning systems, or providing renewable energy for healthcare facilities, or providing climate resilient water and sanitation, and so on. We included these in the WHO investment case that we launched last year. The conclusion of that is if you implemented about 5 of these core interventions to the maximum extent possible, you would save about as many lives as anything you could do with infectious disease or anything else that the world works on. So we have to be able to promote those, evaluate those solutions, promote them, and then bringing it back to the topic of this session to track whether countries are actually doing that, and whether we're doing that as a global community. Everybody in the world should probably be covered by a heat health warning system these days. There is no reason why healthcare facilities around the world should not now have access to renewable energy. So those are the kinds of things that I think, I'd like to connect that back to some of the comments made earlier, including Stella's point, which is that we need to be able to track not just a better description of the problem, but are we doing the things that we know work to some extent for part of the issue in order to make it better? Because that's what we need to convince people in order to invest.
Mm-hmm. Thank you, Diarmid. Fantastic point. We need to have clear indicators to monitor and evaluate the success or failure of different interventions and to justify the investment and the finance from different sectors, from the ministries of health. And if we don't have strong baseline data and strong longitudinal surveillance systems, we also won't be able to test, for example, how a heat early warning system was able to avert damages to save lives. And so that's really critical. And then I go back to my other comment using my moderator's prerogative here, which is, are we gathering the right data? And I always come to the issue that if the ICD codes in the hospitals and the clinics are not recording health outcomes in a way that is explicitly linked to climate events, to weather events, for example, someone who comes in with cardiac distress, being able to link to link that directly to a heat event, it is much harder to make the case that these interventions are saving lives and saving resources for countries around the world. So I do think we need to think about how we are actually monitoring data at the baseline so that we can put in these indicators and show in a much more definitive and clear way to our decision makers and funders around the world the critical need to invest in life-saving technologies and interventions. Okay, we are at the end of the panel, so this is going to be what I call your TikTok moment. 20 seconds, what is the main message you want everyone here to take home as we wrap up the panel? Please, over to you, Kevin.
Yeah, I wrote this down because it resonates a lot with me, and it is, if we cannot define success through targets and indicators, we lack the foundation to identify and seize opportunity for innovation. And that's, I think, where we're at now.
Thank you, Kevin. Stella?
I think I'm going to be a little bit more provocative with Andrêa. Andrêa, you have such wonderful possibilities in data. So I think that creating a regional data harmonization platforms with your guidelines and tools for data cleanings and governments that can use in a whole, I think that's the future, at least for Latin America, and we should actually start discussing how to do that.
Thanks, Stella. Andrêa?
So I think I will follow the idea that we need to improve our capacity of sharing and our capacity building so we can share what we need to create this climate governance. So this will include all those issues that we are talking right now, and this will help us to create a resilient society, because we're still far away to create a resilient society considering the effect of climate change.
Thank you, Andrêa. Sheetal?
I think for me, it will be really making sure that all climate health processes are inclusive and collaborative with the vulnerable groups. Make sure we are working very closely with local and national actors, even in defining these metrics, because it is their outcome that we were trying to improve. So I think that's my bottom line. Be as inclusive as possible and make sure we involve the kind of vulnerable groups in all the discussion around climate health measurement as well as other processes.
Thank you so much, Sheetal. Diarmid, last word here.
Yeah, thanks. I would say that basically 3 things. First, identify things that work, whether that's in a humanitarian setting or whether it's carbon emissions from the world's biggest health system. You've got a target. You should be able to identify interventions that make it better. Track your coverage of those interventions, and then track the outcome to check that we're actually making progress. Repeat that.
Fantastic. And my message, my take-home message for everyone is, don't let perfection be the enemy of the good. We need to monitor and evaluate where we are with the systems that we have in place. Yes, we can do better, but today there are more opportunities than ever, and this shouldn't be a barrier to action, especially in places where we know clearly that there's a desperate need to intervene and to invest to save lives around the world. Thank you.
Diana, thank you.
Thank you, everyone. Thank you, Anna. Bye-bye.